My disc is almost gone. Is there anything that can bring it back, or do I need surgery? My name is Dr. Ryan Peebles, and I have dedicated the last 20 years of my life to better understanding and reversing the root causes of chronic lower back pain. Can you heal a damaged disc, or a degenerated disc, or a herniated disc? It really matters if you're doing the right thing. And the research that's been done is primarily based on procedures and modalities and different treatments that may not be the right thing. So the outcomes of the research may not be pertinent to, say, someone who's doing core balance training, which is something that I believe that works really well. Because what I believe is more important is that you can get back to living a normal life, even with an imperfect disc. And so that's what's the most important thing. But as far as the actual physical healing, physiological process where healing takes place, I think that you could potentially have some healing take place and get the disc into a condition where it's functional and doing its job, and the problem that was originally causing the disc to degenerate, the root cause, is no longer a factor. It's non-existent anymore. And so you've halted the degeneration, and you've gotten to the point where you can continue living your life normally and do the things that you want to do without further damaging the disc. And so we'll get deeper into that. We have a moderate to severely degenerated disc here. And you can see that the disc shows up as black. A healthy disc will show up as white. The white is the fluid. What can you do about this? Can you bring this back so that it looks back like this? I don't believe so. But at the same time, the most important thing to focus on is not so much the condition of the disc, because that really brings with it lots of stress and psychological issues like, I'm broken. And I've talked a lot about this in the past. That can have an effect on our relationship with our body and the way that we move. And so instead of focusing on the problem, the damage that's been done, you can think about it like a scar on the outside of your body, right? So I have a scar on my head right here from cracking my head open, and that happened when I was a young kid, and I knew that was never gonna go away, the scar, but the problem that caused the scar did go away, right? I don't continue to fall on my head in that spot, and so it was able to heal, and I'm able to function normally, and I believe that's the same thing that can happen with a disc. So the important thing is that you remove the cause of the problem that was contributing to the degeneration or the herniation, whatever the damage is, and you allow what's left, the scarred tissue, to heal up, and that you've stopped the progression of degeneration. And that, at that point, is where I believe that the body will reduce the pain signals, because the pain signals are a result of damage happening, or the body sends signals to protect potential damage. But I think if that risk factor is removed and the damage is no longer happening and the body can feel safe, that the pain can actually go away. You can get back to doing the things that you love, and that's what's important. So we want to zoom out from this, the focus of our mind and our mental state on the damage that's been done, and we want to zoom out. We want to focus on the health of this. And if we have imbalances going on that look like this, that might be furthering along the problem that we've zoomed in on so far with a high technology camera on really, really fine issues in the body. And so in the same way that I don't go and continue to look in a mirror at the scar on my head and focus on it so much that it has an impact on my life and my psychology, that's what I encourage you to do as well. Okay, I've had this image done. I'm aware that the damage is done. I don't really have a lot of control over this, but I do have control over this, and I can bring my body back into balance. And if my body starts feeling good, maybe it'll stop sending me pain signals because I've stopped contributing to the damage, and then I can focus on my life and get back to the things that I love doing. And so, can you heal a damaged disc? A little bit, but is that the question you should be asking? I don't think so. I think the question you should be asking is, can I get back to a normal life with a damaged disc? And the answer to that is I believe 100% absolutely yes. Can you get back to a normal life with a scar on your skin? Does it affect the function of your life? Not unless you let it, psychologically. Switch your focus to, can I function normally with a scar? Yes, you can. And so a damaged disc is the same situation. If you can get down on the floor and do the things that will help your body and reduce the contributing factor that caused the disc to be damaged, I believe your body will send less pain signals. And if you can bring your body back to balance, I think your body can get to the point where it sends no more pain signals because you're not damaging your body anymore. You've halted the damage and the risk of damage is not there. So your body is not sending the warning alarms, and you can get back to doing the things that you love. And that's the question that I want you to be asking is, can I get back to a normal life with a damaged disc? And the answer is yes. If the answer is no, if you can't do the things that you need to do, then that's when you can ask a question about surgery. But for most people, you can get through at least module 1 of the program, and it's extremely gentle. So if that 1 week helps you make a tiny bit of progress, then you can build on that progress by having another week with a tiny bit of progress. And then you're going in the right direction all of a sudden. But if you've gotten to the point where it's this far and it's bone on bone and you are unable to do the things that you need to do to bring your body back into balance because your body is not functional anymore, or the pain is too strong that you cannot get down on the floor to do the exercises to bring your body back into balance, it's at that point where surgery should be considered because you can't do the things to remove the problem. So that's situation number 1 where surgery can be considered is, can you get down on the floor and can you do the things if you're in the program or not? And if you're not, then, and you're in this situation, I encourage you to just do the free trial. And can you do those things in the first week? They're very gentle. And if you can, and if you feel the benefits and you can have the next day feel a tiny bit better than the day before, then you can build on that. And so maybe you can avoid surgery. The other situation where you might need surgery is if you've lost function, physical motor control of your muscles, and you can no longer lift your leg out to the side or lift your foot up. That might be a situation where you need to go get the part of the disc that is pressing on that nerve removed. And that's not where the journey stops, because it didn't remove the problem. Surgery only removed the compression on the nerve. It didn't remove the problem that caused the disc to compress the nerve. And so the work begins at that point of the surgery where, okay, now I can do the things, and I'm gonna start my rehab process, my journey now from here, because I can now do the things. So those are the 2 situations where surgery would be considered. But otherwise, if this is your question, I'm worried about my disc, is there anything I can do to bring it back, or do I need surgery? Ask yourself a different question. If you can be okay with having an imperfection on your body, such as a scar on your skin, then you can be okay with having an imperfection on the inside of your body that you can only see because of technology, high-powered images. And if you can be okay with that imperfection and be able to get your full function of your body back and the pain be reduced or gone and be able to live a normal life, then you don't need to be asking this question, do I need surgery? Or can I bring my disc back? Because you don't need your disc back to live a normal life. You just need to remove the problem that caused the disc to degenerate. And I strongly believe you can live a normal life if you remove the problem, the cause of the problem. So that's where I stand on, can you heal a damaged disc? Literally, a little bit, probably. But I think the question is that you need to be asking is different. As we walk away from another stream, go do something healthy for your body. And until next time, get down on the floor and connect to your core. Take care, everyone.